Question 1. The evaluation methodology shows a therapist who, after several sessions of exploring a couple's conflict patterns, presents a summary of their findings and asks the couple to reflect on its accuracy and identify specific areas where they feel the summary resonates most and least, before discussing potential intervention strategies. Option A. This approach is best because it integrates objective assessment with the couple's subjective experience. Fostering collaboration and ensuring feedback is tailored and actionable, aligning with ethical standards of effective and client-centered therapy. Option B. This approach is inadequate because it relies on a single summary rather than continuous granular feedback throughout each session to capture the nuances of the couple's dynamic. Option C. This approach is problematic because it places too much emphasis on the couple's subjective interpretation, potentially leading to disagreements that derail the therapeutic process and overlook the therapist's professional judgment. Option D. This approach is flawed as it delays the introduction of interventions, prolonging the couple's distress and failing to provide them with immediate tools to manage their conflicts. The correct answer is A. This approach is best because it integrates objective assessment with the couple's subjective experience. Fostering collaboration and ensuring feedback is tailored and actionable, aligning with ethical standards of effective and client-centered therapy. Explanation. The evaluation methodology shows a therapist utilizing a structured approach to ongoing assessment and feedback within Gottman method couples therapy. This scenario is professionally challenging because it requires the therapist to balance the need for objective data with the subjective experience of the couple, ensuring that feedback is constructive and actionable without overwhelming or alienating either partner. The Gottman method emphasizes a data-driven approach, making ongoing assessment crucial for tracking progress, identifying persistent issues, and adapting interventions. The correct approach represents best professional practice because it aligns with the core principles of the Gottman method, which advocates for regular check-ins and the use of assessment tools to inform therapeutic direction. This method emphasizes the importance of the therapist acting as a skilled observer and facilitator, using feedback to empower the couple to understand their dynamics and make informed choices. Specifically, it reflects the ethical obligation to provide competent and effective therapy by continually evaluating its impact and adjusting strategies as needed. This iterative process ensures that therapy remains relevant to the couple's evolving needs and that progress is being made towards their stated goals, thereby upholding the professional standard of care. An incorrect approach that relies solely on the therapist's subjective impression, without seeking explicit feedback or utilizing assessment tools, fails to meet the standard of care. This could lead to a misinterpretation of the couple's progress or a lack of awareness regarding the effectiveness of interventions, potentially causing harm by prolonging ineffective therapy or missing critical opportunities for intervention. Ethically, this approach could be seen as a failure to adequately monitor therapeutic progress and a lack of transparency with the clients about the therapy's efficacy. Another incorrect approach that involves overwhelming the couple with excessive or overly critical feedback without sufficient support or context can be detrimental. This can lead to defensiveness, increased conflict, and a breakdown of the therapeutic alliance, undermining the very goals of therapy. From a regulatory and ethical standpoint, this demonstrates a lack of skill in delivering feedback and a failure to create a safe and supportive therapeutic environment, potentially violating principles of beneficence and non-maleficence. A further incorrect approach that neglects to solicit the couple's perspective on the feedback provided, assuming their understanding and agreement, is also problematic. This can result in a disconnect between the therapist's assessment and the couple's lived experience, leading to misunderstandings and a lack of buy-in for subsequent interventions. Ethically, this represents a failure to engage in a collaborative therapeutic process and to respect the autonomy of the clients by not ensuring their active participation in understanding and responding to the assessment. The professional decision-making process for similar situations should involve a commitment to continuous learning and adherence to established therapeutic models. Therapists should regularly integrate assessment tools and structured feedback mechanisms into their practice, ensuring these are used in a way that is sensitive to the couple's emotional state and therapeutic goals. This involves active listening, seeking clarification, and collaboratively developing strategies based on both objective data and the couple's subjective experience. A key element is the ongoing evaluation of the therapeutic alliance and the effectiveness of interventions, with a willingness to adapt the treatment plan as necessary, always prioritizing the well-being and progress of the couple. Question 2. Compliance review shows a couple engaged in frequent, intense arguments where one partner often becomes highly critical and the other withdraws completely. While the couple expresses a desire to improve, their current conflict style is causing significant distress and emotional distance. As a certified Gottman therapist, what is the most appropriate initial approach to address the role of conflict in their relationship? Option A. Advise the couple to avoid discussing sensitive topics for a period to reduce the frequency of arguments, focusing instead on shared positive activities. Option B. Emphasize that conflict is a natural and unavoidable part of all relationships, and encourage them to simply accept their current argumentative style as a normal dynamic. Option C. Focus on teaching the couple advanced negotiation techniques to win arguments and reach definitive resolutions quickly. Option D. Guide the couple in identifying the underlying emotions and unmet needs driving their conflict, and introduce Gottman method tools for softening startup and making repair attempts to de-escalate the current pattern. The correct answer is D. Guide the couple in identifying the underlying emotions and unmet needs driving their conflict, and introduce Gottman method tools for softening startup and making repair attempts to de-escalate the current pattern. Explanation. This scenario presents a professional challenge because it requires the therapist to navigate the delicate balance between acknowledging the inherent role of conflict in relationships, as per Gottman method principles, and ensuring that the couple's conflict management strategies do not escalate into harmful or abusive dynamics. The therapist must assess risk while remaining within the ethical and regulatory boundaries of their practice as a certified Gottman therapist. The correct approach represents best professional practice because it directly applies Gottman method principles to de-escalate conflict and foster constructive communication. By focusing on identifying the underlying needs and emotions driving the conflict, and by teaching repair attempts and softening startup, the therapist is actively promoting a healthier relational dynamic. This aligns with the ethical imperative to provide evidence-based interventions that promote well-being and prevent harm. The Gottman method's emphasis on understanding the four horsemen and developing antidotes is a core component of its efficacy in managing conflict constructively. An incorrect approach that focuses solely on the inevitability of conflict without assessing for escalation or potential harm would be ethically problematic. It risks normalizing unhealthy or even abusive patterns of interaction, failing to protect the vulnerable party or the relationship itself. This could be seen as a failure to adhere to professional standards of care, which mandate intervention when conflict crosses into damaging territory. Another incorrect approach that prioritizes immediate conflict resolution above all else, without exploring the deeper emotional landscape or teaching sustainable communication skills, would also be professionally deficient. This approach might lead to superficial agreements that do not address the root causes of conflict, leaving the couple ill-equipped to handle future disagreements. This could be interpreted as a failure to provide comprehensive and effective therapeutic intervention. A third incorrect approach that avoids addressing conflict directly due to fear of exacerbating it would be a failure to engage with the core of the Gottman method. While caution is warranted, avoidance is not a therapeutic strategy and can lead to stagnation and resentment within the relationship. This would represent a departure from the established efficacy of the Gottman method in helping couples navigate and resolve conflict. The professional decision-making process for similar situations involves a continuous risk assessment integrated with therapeutic intervention. Therapists must be attuned to the intensity and nature of the conflict, looking for signs of escalation, contempt, criticism, defensiveness, and stonewalling. They should then apply Gottman method interventions that are appropriate for the couple's current stage of conflict, always prioritizing safety and the development of constructive communication skills. This involves a dynamic assessment of the couple's capacity for repair and a willingness to adapt interventions as needed. Question 3. Research into the Gottman method indicates that a significant predictor of relationship satisfaction is the presence of shared goals and dreams. A couple presents for therapy reporting frequent arguments stemming from a general sense of dissatisfaction and a feeling that they are growing apart. During initial sessions, it becomes apparent that while they love each other, they have not actively discussed or aligned their visions for their future life together, leading to unspoken resentments and differing expectations. What is the most appropriate risk assessment and therapeutic approach for the certified Gottman therapist in this situation? Option A. Focus primarily on de-escalating immediate conflicts and improving communication skills, as these are foundational to addressing any underlying issues, including differing life aspirations. Option B. Guide the couple through exercises to identify, articulate, and build upon shared goals and dreams, assessing the risk of relationship breakdown due to unaddressed divergence and working collaboratively to foster a shared vision for their future. Option C. Acknowledge the couple's feelings of growing apart, but conclude that their differing life aspirations are a natural consequence of individual growth and may not be a primary area for therapeutic intervention within the Gottman framework. Option D. Advise the couple on what constitutes a healthy and fulfilling shared dream, suggesting specific goals they should pursue together to ensure future compatibility. The correct answer is B. Guide the couple through exercises to identify, articulate, and build upon shared goals and dreams, assessing the risk of relationship breakdown due to unaddressed divergence, and working collaboratively to foster a shared vision for their future. Explanation: this scenario is professionally challenging because it requires the therapist to navigate a delicate balance between respecting client autonomy and guiding them towards a healthier relational dynamic. The Gottman method emphasizes the importance of shared goals and dreams as a cornerstone of relationship satisfaction and longevity. When a couple presents with divergent or unarticulated aspirations, it can be a significant predictor of future conflict and dissatisfaction. The therapist must assess the risk of relationship breakdown due to this divergence without imposing their own values or solutions. The correct approach represents best professional practice because it directly addresses a core tenet of the Gottman method: fostering a shared vision for the future. By helping the couple identify, articulate, and work towards common goals and dreams, the therapist is actively building a stronger foundation for their relationship. This aligns with ethical guidelines that mandate therapists to work collaboratively with clients to achieve their stated goals, promoting their well-being and relationship health. This approach is proactive in mitigating future conflict and enhancing marital satisfaction, which is a primary objective in Gottman method couples therapy. An incorrect approach that focuses solely on immediate conflict resolution without addressing the underlying divergence in goals fails to address a root cause of potential future distress. This could be seen as a failure to provide comprehensive therapeutic intervention, potentially leading to a superficial resolution of issues. Ethically, this might be considered a lapse in due diligence, as the therapist has not fully explored the factors contributing to the couple's difficulties. Another incorrect approach that involves the therapist imposing their own vision of what constitutes a good shared goal or dream is a significant ethical violation. This oversteps professional boundaries, disrespects client autonomy, and introduces personal bias into the therapeutic process. It moves away from a client-centered approach and could lead to resentment and a breakdown of trust. A further incorrect approach that dismisses the importance of shared goals and dreams as a secondary concern, prioritizing other therapeutic interventions, overlooks a critical component of relationship stability as identified by Gottman's research. This could result in a failure to equip the couple with the tools to build a shared future, leaving them vulnerable to future relational challenges. The professional decision-making process for similar situations should involve a thorough assessment of the couple's current dynamic, identifying areas of strength and vulnerability. The therapist should then, in collaboration with the couple, explore the extent to which their individual and shared aspirations align or diverge. Utilizing Gottman method interventions specifically designed to foster shared meaning and dreams, such as the shared life dream exercise, would be paramount. The therapist must remain neutral, facilitating the couple's own discovery and articulation of their shared future, rather than directing it. This process requires empathy, active listening, and a deep understanding of Gottman's research on relationship stability. Question 4. Strategic planning requires a certified Gottman therapist to effectively assess the dynamics of a couple presenting with significant communication breakdowns and underlying resentments. During the initial assessment phase, the therapist has conducted joint sessions and is considering how best to gather a comprehensive understanding of each partner's individual experiences and perspectives without compromising the therapeutic alliance or ethical guidelines. What is the most appropriate approach for the therapist to take in this situation? Option A. Conduct individual sessions with each partner, clearly explaining the purpose of these sessions to both, and then integrate the information gathered into the joint therapeutic work, ensuring transparency about how individual insights will inform the couple's progress. Option B. Focus exclusively on joint sessions, encouraging each partner to share their individual concerns openly within the couple's presence, and avoid individual sessions to maintain strict neutrality. Option C. Conduct individual sessions with each partner and then selectively share specific insights with the other partner that the therapist believes would be most beneficial for the couple's progress, without explicit consent for each disclosure. Option D. Schedule individual sessions with each partner and maintain strict confidentiality of all information shared in these sessions, only discussing general themes in joint sessions, without revealing specific details from individual interviews. The correct answer is A. Conduct individual sessions with each partner, clearly explaining the purpose of these sessions to both, and then integrate the information gathered into the joint therapeutic work, ensuring transparency about how individual insights will inform the couple's progress. Explanation. This scenario presents a common challenge in couples therapy where a therapist must navigate the complexities of individual disclosures within the context of a joint therapeutic relationship. The Gottman method emphasizes a balanced approach to assessment, ensuring that both partners feel heard and understood while maintaining the integrity of the therapeutic alliance with the couple. The challenge lies in gathering comprehensive information without inadvertently creating alliances with one partner over the other or compromising confidentiality in a way that damages the therapeutic process. The correct approach involves a structured, yet flexible, assessment that prioritizes the couple's shared experience. This aligns with the Gottman method's focus on understanding the couple's interaction patterns, shared history, and individual perspectives within the relational context. By conducting individual interviews as part of the initial joint assessment, the therapist can gather crucial information about each partner's unique experiences and concerns. However, the critical element is how this information is processed and utilized. The therapist must maintain transparency with the couple about the purpose of these individual sessions and ensure that no information is held back from one partner without explicit consent and a clear therapeutic rationale that benefits the couple's progress. This approach upholds ethical principles of informed consent, confidentiality within the couple's context, and the therapist's role as a neutral facilitator of relational change. An incorrect approach would be to solely rely on joint sessions for assessment, potentially missing critical individual nuances that impact the relationship. Another incorrect approach would be to conduct individual sessions and then selectively share information with one partner, creating an imbalance and potentially damaging trust. This violates the ethical principle of maintaining neutrality and can lead to perceptions of favoritism, undermining the therapeutic alliance. Furthermore, failing to obtain explicit consent before sharing information gathered in individual sessions with the other partner is a breach of confidentiality and ethical practice. A third incorrect approach might involve prioritizing one partner's narrative over the other's without a systematic process for understanding both perspectives, which is contrary to the Gottman method's emphasis on a balanced and comprehensive assessment of the relationship system. Professionals should employ a decision-making framework that begins with understanding the ethical and theoretical underpinnings of their chosen modality. In the context of the Gottman method, this means prioritizing the couple as the client system. When individual information is deemed necessary, the process must be transparent, consensual, and aimed at understanding the relational dynamics. This involves clearly communicating the purpose of individual sessions, obtaining consent for how information will be used, and ensuring that the assessment process serves the ultimate goal of improving the couple's relationship. Question 5. Benchmark analysis indicates that in a couple's therapy session, partner A expresses significant distress and feelings of being overwhelmed by a recent work-related setback. Partner B, in an attempt to be helpful, immediately begins suggesting strategies for partner A to cope with the stress and offering reassurances that things will get better. As the certified Gottman therapist, what is the most appropriate immediate response to facilitate emotional connection and validation? Option A. Acknowledge partner A's distress and then ask partner B to share their own perspective on the work setback to gain a fuller picture. Option B. Gently interrupt partner B and reflect partner A's expressed feelings back to them, acknowledging the difficulty of their experience before allowing partner B to offer support. Option C. Validate partner B's desire to help and then pivot the conversation to how partner A's work stress is impacting their relationship dynamics. Option D. Encourage partner B to continue offering solutions, as this demonstrates their care and desire to help partner A overcome the challenge. The correct answer is B. Gently interrupt partner B and reflect partner A's expressed feelings back to them, acknowledging the difficulty of their experience, before allowing partner B to offer support. Explanation. This scenario presents a common challenge in couples therapy where one partner expresses distress, and the other partner's immediate reaction is to offer solutions or justifications, potentially invalidating the first partner's feelings. The Gottman method emphasizes the importance of active listening and validation as foundational skills for building emotional connection and safety within a relationship. The correct approach, which involves reflecting the speaker's feelings and acknowledging their perspective without judgment or immediate problem solving, represents best professional practice because it directly aligns with the core principles of the Gottman method. This approach fosters a sense of being heard and understood, which is crucial for de-escalating conflict and strengthening the therapeutic alliance. It creates an environment where both partners feel safe to express their vulnerabilities, a key component of Gottman's research on stable relationships. Ethically, this approach upholds the therapist's duty to facilitate effective communication and emotional attunement between partners. An incorrect approach that immediately jumps to problem-solving or offering advice fails to validate the emotional experience of the distressed partner. This can lead to the distressed partner feeling unheard, dismissed, or misunderstood, potentially exacerbating their feelings of isolation and resentment. From an ethical standpoint, this approach could be seen as a failure to provide competent therapy by neglecting fundamental communication skills essential for couples. It risks undermining the therapeutic goals of fostering empathy and connection. Another incorrect approach might involve the therapist taking sides or appearing to agree with one partner's perspective over the other's, even implicitly. This can create an imbalance in the therapeutic space, making one partner feel alienated and less likely to engage openly. Ethically, therapists are bound to maintain neutrality and impartiality, ensuring a safe and equitable environment for both individuals. The professional decision-making process for similar situations should involve a conscious effort to prioritize the emotional experience of the speaker. Therapists should first focus on understanding and reflecting the feelings being expressed before considering any problem-solving or advice-giving. This involves active listening techniques such as paraphrasing, reflecting feelings, and summarizing. The therapist must also be attuned to nonverbal cues and the underlying emotional tone of the communication. When faced with a partner who immediately offers solutions, the therapist should gently redirect them back to listening and validating their partner's experience, perhaps by saying something like, "It sounds like partner A is really struggling with this right now. Before we think about solutions, can we just sit with how partner A is feeling?" This process ensures that the therapeutic intervention is grounded in the principles of empathy, validation, and effective communication, as advocated by the Gottman method. Question 6. Which approach would be most consistent with the research foundations and empirical evidence underpinning the certified Gottman therapist designation when addressing a couple presenting with chronic criticism and defensiveness? Option A. Prioritizing interventions directly derived from Gottman's research on the 4 horsemen of the apocalypse and the principles of softening the startup, as these have extensive empirical validation within the Gottman Institute's work. Option B. Implementing interventions based on anecdotal success stories shared by colleagues without verifying their alignment with established Gottman research on these specific issues. Option C. De-emphasizing the Gottman research on criticism and defensiveness, opting instead for a more intuitive approach based on the therapist's personal feelings about the couple's interactions. Option D. Focusing primarily on techniques learned in a general couples therapy workshop, assuming that broad therapeutic skills will naturally address the specific dynamics of criticism and defensiveness. The correct answer is A. Prioritizing interventions directly derived from Gottman's research on the 4 horsemen of the apocalypse and the principles of softening the startup, as these have extensive empirical validation within the Gottman Institute's work. Explanation. This scenario presents a professional challenge because it requires a therapist to integrate cutting-edge research findings into their practice while maintaining ethical integrity and client well-being. The Gottman method is built upon extensive empirical research, and a certified Gottman therapist is expected to understand and apply these research foundations. The challenge lies in discerning which interventions are truly supported by robust evidence and avoiding those that may be anecdotal, outdated, or not aligned with the core principles of the Gottman method's research base. Careful judgment is required to ensure that therapeutic decisions are evidence-based and ethically sound, prioritizing the client's best interests. The correct approach represents best professional practice because it directly aligns with the core tenets of the Gottman method, which emphasizes the importance of research-informed interventions. By prioritizing interventions that have strong empirical support within the Gottman research framework, the therapist ensures that they are utilizing techniques proven to be effective in fostering healthy relationships. This adherence to research foundations is not only a hallmark of the Gottman method, but also an ethical imperative, as it demonstrates a commitment to providing clients with the most effective and evidence-based care available. This approach upholds the therapist's responsibility to stay current with relevant research and apply it judiciously. An incorrect approach that relies solely on personal clinical experience without grounding in the Gottman research would be professionally unacceptable. This failure stems from a disregard for the empirical evidence that underpins the Gottman method. While clinical experience is valuable, it should inform, not replace, the application of research-backed interventions. Another incorrect approach might involve adopting interventions from other therapeutic modalities without critically evaluating their compatibility with the Gottman method's research base or their specific applicability to the Gottman's identified relationship dynamics. This could lead to fragmented or ineffective therapy. A third incorrect approach would be to dismiss or de-emphasize research findings that challenge existing clinical assumptions, demonstrating a resistance to evidence-based practice and a potential ethical lapse in failing to provide the most effective treatment. The professional decision-making process for similar situations should involve a continuous cycle of learning, critical evaluation, and application. Therapists should actively engage with the latest Gottman research, attend advanced training, and critically assess how new findings integrate with established interventions. When considering new techniques or approaches, they should ask, what is the empirical evidence supporting this within the Gottman framework? And how does this align with the core principles and research findings of the Gottman method? This critical, evidence-based approach ensures that therapeutic decisions are grounded in robust research and ethically sound, ultimately benefiting the client. Question 7. The review process indicates that a certified Gottman therapist is working with a couple experiencing intense conflict. During a session, one partner becomes highly distressed, expressing feelings of being overwhelmed and unable to think clearly. The therapist's primary objective is to teach emotional regulation skills. Which of the following interventions best aligns with the Gottman method's approach to teaching emotional regulation in such a situation? Option A. Introduce a generic mindfulness exercise that is not specifically linked to Gottman's relational conflict resolution strategies. Option B. Acknowledge the partner's feelings but suggest they try to calm down on their own, as the therapist's role is to address the relationship issues, not individual emotional management. Option C. Immediately offer advice on how the partner should manage their emotions, focusing on logical reasoning to overcome the distress. Option D. Validate the partner's distress and then guide them through a Gottman-identified physiological soothing technique, followed by a brief discussion of how this can be used to de-escalate before attempting to re-engage in problem-solving. Correct answer is D. Validate the partner's distress and then guide them through a Gottman-identified physiological soothing technique, followed by a brief discussion of how this can be used to de-escalate before attempting to re-engage in problem-solving. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the therapist to balance the immediate emotional distress of a client with the long-term goal of teaching sustainable emotional regulation skills. The client's acute distress might tempt the therapist to offer quick fixes or solely focus on symptom relief, potentially undermining the core therapeutic objective. The therapist must navigate the client's immediate needs while adhering to the Gottman method's principles, which emphasize building foundational skills for relationship health. This requires careful judgment to ensure interventions are both supportive and therapeutically effective within the ethical and professional guidelines of a certified Gottman therapist. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the Gottman method's emphasis on skill building for emotional regulation within relationships. By validating the client's feelings and then gently guiding them towards identifying and practicing specific, evidence-based Gottman techniques for managing distress, such as physiological soothing or taking a break, the therapist is empowering the client. This approach respects the client's current emotional state while actively teaching them tools that can be applied in real time and in future relationship conflicts. This aligns with the ethical imperative to provide competent and effective therapy that promotes client well-being and autonomy. Incorrect approach is analysis. One incorrect approach involves solely focusing on validating the client's emotions without introducing any skill-building components. This fails to meet the professional standard of a certified Gottman therapist, as it neglects the core mandate of teaching emotional regulation skills. Ethically, it could be considered a failure to provide comprehensive treatment, leaving the client without the tools needed for long-term improvement. Another incorrect approach is to immediately prescribe a solution or offer advice without first validating the client's experience or assessing their current capacity to implement a new skill. This can be perceived as dismissive of the client's feelings and may lead to frustration if the prescribed solution is not well received or understood. From a regulatory and ethical standpoint, this bypasses crucial steps in therapeutic engagement and skill acquisition, potentially leading to ineffective treatment and a breach of professional responsibility. A third incorrect approach might involve solely relying on generic stress reduction techniques that are not specifically integrated into the Gottman method's framework for relationship conflict. While these techniques might offer temporary relief, they do not equip the couple with the specific skills needed to navigate relational dynamics as taught by the Gottman Institute. This represents a failure to adhere to the specialized training and methodology expected of a certified Gottman therapist, potentially leading to a less effective and less specialized therapeutic outcome. Professional reasoning. Professionals should employ a decision-making framework that prioritizes client-centered care, adherence to therapeutic modality, and ethical practice. This involves 1. Active listening and validation of the client's emotional experience. 2. Assessment of the client's current capacity and readiness for skill acquisition. 3. Introduction of relevant, evidence-based techniques from the Gottman method, tailored to the client's specific needs and challenges. 4. Gradual practice and reinforcement of these skills, with ongoing feedback and adjustment. 5. Continuous ethical self-reflection to ensure interventions are both supportive and aligned with professional standards. Question 8. The analysis reveals that a certified Gottman therapist is structuring a session for a couple experiencing frequent, escalating arguments. The therapist has a clear agenda based on the Gottman method's approach to conflict regulation, including specific exercises for softening startup and accepting influence. However, during the session, one partner becomes visibly distressed and begins to share a deeply personal trauma unrelated to the immediate conflict, which is clearly impacting their ability to engage with the planned exercises. Considering the principles of structuring sessions for maximum effectiveness within the Gottman framework, which of the following represents the most appropriate course of action for the therapist? Option A. Allow the couple to freely explore the disclosed trauma for the entire session, encouraging them to share all associated feelings and memories without any attempt to steer the conversation or link it back to their relationship issues. Option B. Gently acknowledge the partner's distress, offer a brief moment of empathetic validation, and then skillfully guide the conversation back to the planned conflict regulation exercises, perhaps by reframing the trauma's impact on their current arguments. Option C. Immediately pause all planned exercises and dedicate the remainder of the session to exploring the disclosed trauma in depth, deferring the conflict regulation work to a future session. Option D. Focus exclusively on the partner who is not experiencing distress, continuing with the planned conflict regulation exercises as a way to provide stability and structure amidst the other partner's emotional outpouring. The correct answer is B. Gently acknowledge the partner's distress, offer a brief moment of empathetic validation, and then skillfully guide the conversation back to the planned conflict regulation exercises, perhaps by reframing the trauma's impact on their current arguments. Explanation. This scenario presents a common challenge in couples therapy, balancing the need for structured progress with the inherent unpredictability of human relationships and individual emotional responses. The Gottman method emphasizes a structured approach to sessions to ensure that core issues are addressed systematically and that couples develop concrete skills. The challenge lies in adapting this structure to the unique dynamics of each couple without losing the framework's effectiveness. Careful judgment is required to discern when to adhere strictly to the model and when to allow for emergent issues or deeper emotional exploration within the session's framework. The correct approach represents best professional practice because it aligns with the core tenets of the Gottman method, which are designed to facilitate lasting change by systematically addressing the foundational elements of a healthy relationship. This involves utilizing specific interventions and exercises within a structured session flow to build skills in communication, conflict management, and emotional connection. Adherence to this structured approach ensures that sessions are purposeful and that couples are guided towards tangible improvements, as advocated by the Gottman Institute's training and ethical guidelines for certified Gottman therapists. An incorrect approach that prioritizes unstructured, free-flowing conversation without clear objectives or interventions fails to leverage the evidence-based techniques of the Gottman method. This can lead to sessions that feel unproductive, where couples may vent without developing new skills or addressing underlying patterns, potentially violating ethical obligations to provide competent and effective therapy. Another incorrect approach that focuses solely on one partner's issues without integrating the couple's dynamic neglects the relational nature of the therapy and the Gottman method's emphasis on the dyad. This can lead to an imbalance in the therapeutic process and may not address the root causes of relational distress, again, falling short of ethical standards for couples therapy. A third incorrect approach that rigidly adheres to a script without adapting to the couple's immediate emotional needs or progress can alienate them and hinder genuine connection, undermining the therapeutic alliance and the effectiveness of the interventions. Professionals should employ a decision-making framework that begins with a thorough assessment of the couples presenting issues and relationship dynamics. This assessment informs the selection of appropriate Gottman interventions and the structuring of sessions. The therapist must remain flexible, using the Gottman framework as a guide rather than a rigid prescription, and be prepared to adapt the session's flow based on the couple's engagement, emotional state, and progress towards therapeutic goals. Regular self-reflection and consultation with supervisors or peers can further refine this decision-making process, ensuring adherence to ethical guidelines and best practices in couples therapy. Question 9. Stakeholder feedback indicates a growing interest among certified Gottman therapists in integrating emerging research on attachment styles and neurobiology into their practice. Considering the historical context and development of the Gottman method, which approach best balances the evolution of therapeutic understanding with the foundational principles of the Gottman approach. Option A. Adopt the latest research on attachment and neurobiology wholesale, as these represent the most current and advanced understanding of relationship dynamics, even if they diverge significantly from original Gottman concepts. Option B. Focus exclusively on the original Gottman method materials and techniques, viewing any new research as potentially diluting the established efficacy and historical integrity of the approach. Option C. Blend the Gottman method with other popular relationship therapy models based on current trends, without a specific focus on how these integrations align with the historical development and empirical basis of the Gottman method. Option D. Prioritize a deep understanding of the Gottman method's historical development and empirical foundations, critically evaluating how new research on attachment and neurobiology can be integrated in a way that complements, rather than replaces, core Gottman principles. The correct answer is D. Prioritize a deep understanding of the Gottman method's historical development and empirical foundations, critically evaluating how new research on attachment and neurobiology can be integrated in a way that complements, rather than replaces, core Gottman principles. Explanation. This scenario presents a professional challenge because it requires the certified Gottman therapist to navigate the evolution of therapeutic modalities while remaining grounded in the foundational principles of the Gottman method. The challenge lies in integrating new research and perspectives without diluting the core efficacy and historical integrity of the Gottman approach, which is crucial for maintaining client trust and therapeutic effectiveness. Careful judgment is required to discern which developments genuinely enhance the Gottman method and which might represent a departure from its evidence-based origins. The correct approach represents best professional practice because it prioritizes a deep understanding of the historical context and development of the Gottman method. This involves recognizing how Dr. John Gottman's research, particularly his longitudinal studies on marital stability, laid the groundwork for the method's core concepts like the Four Horsemen, the sound relationship house, and the importance of friendship and shared meaning. By grounding interventions in this historical and empirical foundation, the therapist ensures that their practice is aligned with the method's established efficacy and ethical guidelines, which emphasize evidence-based practice and client well-being. This approach also allows for informed integration of new research, ensuring that any adaptations are consistent with the Gottman method's core tenets and have demonstrated utility. An incorrect approach that focuses solely on adopting the latest trends in relationship therapy, without critically evaluating their compatibility with the Gottman method's historical development, would represent a regulatory and ethical failure. This is because it risks deviating from the specific training and certification requirements of a certified Gottman therapist, potentially offering interventions that are not empirically supported within the Gottman framework. Such a departure could lead to a breach of ethical standards related to competence and fidelity to the model, potentially harming clients by providing ineffective or misaligned therapeutic strategies. Another incorrect approach that dismisses the historical context and foundational research of the Gottman method in favor of a purely eclectic approach would also be professionally unacceptable. This would fail to uphold the integrity of the Gottman certification, which is predicated on a specific theoretical and practical framework. Ethically, it could be seen as misrepresenting one's expertise and potentially misleading clients who seek the specific benefits of the Gottman method. This approach also overlooks the significant body of research that underpins the method's effectiveness, a key component of evidence-based practice. The professional decision-making process for similar situations should involve a continuous commitment to learning and critical evaluation. Therapists should actively engage with updated Gottman Institute materials, attend advanced trainings, and critically assess how new research aligns with or modifies existing Gottman principles. When considering incorporating new techniques, a therapist should ask, does this align with the core principles and historical development of the Gottman method? Is there evidence supporting its efficacy within this framework? How does this serve the client's best interests within the context of the Gottman method? This reflective practice ensures fidelity to the certification, while allowing for growth and adaptation grounded in evidence and ethical practice. Question 10. The efficiency study reveals that couples who effectively identify and articulate their underlying emotional needs during conflict resolution experience significantly higher relationship satisfaction. A couple presents with recurring arguments where one partner feels unheard and the other feels criticized. The certified Gottman therapist observes that the arguments escalate quickly, often leaving both partners feeling misunderstood and resentful. Which of the following approaches best facilitates the couple's understanding of their emotions in this situation? Option A. Encouraging the couple to focus on practical solutions to the immediate issues causing their arguments, such as dividing chores more equitably. Option B. Suggesting that one partner's emotional reactions are disproportionate to the situation and advising them to manage their feelings more effectively. Option C. Guiding the couple to identify the specific emotions each partner is experiencing and exploring the unmet needs that these emotions are signaling. Option D. Intervening by offering personal anecdotes of how similar conflicts were resolved in the therapist's own relationships. Correct answer is C. Guiding the couple to identify the specific emotions each partner is experiencing and exploring the unmet needs that these emotions are signaling. Explanation. This scenario is professionally challenging because it requires the certified Gottman therapist to navigate the delicate balance between validating a client's emotional experience and guiding them towards constructive relational patterns, all while adhering to the ethical principles of the Gottman method and professional conduct. The therapist must avoid imposing their own interpretations or solutions, and instead facilitate the couple's understanding of their emotional dynamics. The correct approach represents best professional practice because it aligns with the core tenets of the Gottman method, which emphasizes understanding the underlying emotions and needs within a couple's interactions. By focusing on identifying the specific emotions and the unmet needs they represent, the therapist empowers the couple to communicate more effectively and build a stronger foundation of empathy and connection. This approach is ethically sound as it prioritizes client autonomy and well-being, fostering a safe space for emotional exploration without judgment or premature problem-solving. An incorrect approach that focuses solely on behavioral change without addressing the emotional underpinnings would be ethically problematic. It risks superficial fixes that do not resolve the root causes of conflict, potentially leading to repeated patterns of distress for the couple. This could be seen as a failure to provide competent and comprehensive therapy, potentially violating ethical guidelines related to client care and professional responsibility. Another incorrect approach that involves the therapist offering unsolicited advice or taking sides would be a significant ethical failure. This undermines the therapeutic alliance, erodes trust, and can exacerbate existing tensions within the relationship. It moves away from the therapist's role as a neutral facilitator and into a position of judgment, which is contrary to ethical practice and the principles of the Gottman method. The professional decision-making process for similar situations should involve a thorough assessment of the couple's emotional landscape, identifying the specific feelings and underlying needs being expressed. The therapist should then use Gottman-informed interventions to help the couple articulate these emotions and needs to each other, fostering empathy and understanding. This process requires active listening, non-judgmental observation, and a commitment to facilitating the couple's own discovery and growth, rather than imposing external solutions. Question 11. During the evaluation of a couple struggling with frequent arguments, one partner expresses frustration that their attempts to offer solutions are consistently met with defensiveness from their spouse. The partner states, "I just want to help them, but every time I suggest something, they shut down and say I'm not listening. It makes me feel like I can't do anything right." How should the therapist best address this communication dynamic? Option A. Directly tell the partner that their approach is causing the problem and that they need to stop offering unsolicited advice. Option B. Suggest that the couple take a break from discussing solutions until they can manage their emotions better without further exploration of the communication pattern. Option C. Focus on the spouse's defensiveness and explore why they are shutting down without addressing the first partner's communication style. Option D. Validate the partner's desire to help and explore how their suggestions might be perceived as criticism. Then guide them in rephrasing their input using I statements to express their needs and concerns more effectively. Correct answer is D. Validate the partner's desire to help and explore how their suggestions might be perceived as criticism. Then guide them in rephrasing their input using I statements to express their needs and concerns more effectively. Explanation. This scenario presents a common challenge in couples therapy where a partner's communication style, while intended to be helpful, inadvertently escalates conflict. The Gottman method emphasizes the importance of understanding and modifying communication patterns that lead to distress. The professional challenge lies in identifying the underlying intent versus the actual impact of the partner's words and guiding them towards more constructive communication without invalidating their feelings or intentions. The correct approach involves validating the partner's desire to help while gently reframing their communication to focus on I statements and expressing needs, rather than perceived shortcomings of the other partner. This aligns with Gottman's principles of fostering empathy, understanding, and constructive conflict resolution. Specifically, it encourages a shift from criticism and contempt towards a more supportive and collaborative dialogue, which is a cornerstone of building a healthy relationship as outlined in Gottman method training. This approach respects the client's autonomy and empowers them to develop new communication skills. An incorrect approach that focuses solely on the negative impact without acknowledging the partner's intent risks alienating the client and making them defensive. This could be seen as a failure to apply a nuanced understanding of communication dynamics, a key component of Gottman method training. Another incorrect approach that dismisses the partner's feelings or attempts to fix the problem immediately without addressing the communication breakdown bypasses the core issue and fails to equip the couple with sustainable tools. This neglects the therapeutic process of exploration and skill building. A third incorrect approach that overemphasizes the blame on one partner, even if their communication is problematic, violates the principle of neutrality and partnership inherent in the Gottman method, potentially creating further division rather than fostering connection. Professionals should approach such situations by first actively listening to both partners to understand their perspectives and the impact of their communication. They should then use Gottman-derived interventions to help partners identify destructive patterns, understand the underlying needs and emotions, and practice healthier ways of expressing themselves. This involves a process of psychoeducation, skill building, and guided practice within the therapeutic session. Question 12. Governance review demonstrates that a couple from a collectivist cultural background who prioritize family harmony and indirect communication are experiencing significant conflict due to differing expectations regarding financial decisions and extended family involvement. The therapist, trained in the Gottman method, is considering how to best address their issues. Which approach best reflects culturally sensitive therapeutic practice within the Gottman framework? Option A. Focus exclusively on the observable behaviors of their arguments, such as yelling or stonewalling, without delving into the underlying cultural reasons for these behaviors. Option B. Apply standard Gottman conflict resolution techniques directly, assuming that universal principles of communication and compromise will override any cultural differences. Option C. Gently suggest that their cultural beliefs might be hindering their progress and encourage them to adopt more individualistic approaches to problem solving, as often seen in Western relationship models. Option D. Actively inquire about the specific cultural values and norms that influence their decision-making processes and communication styles, and integrate this understanding into the application of Gottman interventions, such as exploring their shared meaning and conflict management strategies in a culturally relevant way. The correct answer is D. Actively inquire about the specific cultural values and norms that influence their decision-making processes and communication styles, and integrate this understanding into the application of Gottman interventions, such as exploring their shared meaning and conflict management strategies in a culturally relevant way. Explanation. This scenario presents a professional challenge because the therapist must navigate deeply ingrained cultural beliefs that may differ significantly from their own or from dominant cultural norms within the therapeutic setting. The Gottman method, while evidence-based, requires adaptation to be culturally sensitive and effective. A failure to acknowledge and integrate cultural influences can lead to misinterpretations, ineffective interventions, and a breakdown of trust, potentially violating ethical principles of competence and cultural humility. The correct approach represents best professional practice because it prioritizes understanding and integrating the couple's cultural context into the therapeutic process. This aligns with ethical guidelines that mandate cultural competence and sensitivity. By actively seeking to understand the cultural underpinnings of their relationship dynamics, the therapist can tailor interventions to be more relevant, respectful, and effective, fostering a stronger therapeutic alliance. This approach demonstrates a commitment to the client's lived experience and acknowledges that relationship constructs are not universal. An incorrect approach that focuses solely on applying standard Gottman interventions without cultural consideration fails to meet the ethical standard of competence. It risks imposing a westernized or dominant cultural framework onto a couple whose experiences are shaped by different values, communication styles, and expectations regarding relationships, marriage, and conflict resolution. This can lead to the couple feeling misunderstood, invalidated, or even pathologized, creating a significant ethical breach of providing appropriate and effective care. Another incorrect approach that dismisses or minimizes the couple's cultural beliefs as irrelevant to their relationship issues is equally problematic. This demonstrates a lack of cultural humility and can be perceived as judgmental or ethnocentric. Ethically, it violates the principle of respecting client autonomy and their right to hold diverse beliefs. It also undermines the therapeutic alliance by signaling that the therapist is not open to understanding the full spectrum of influences on the couple's dynamic. A professional decision-making process for similar situations should begin with a commitment to ongoing self-reflection and education regarding cultural diversity. When working with couples, it is crucial to create a safe space for them to share their cultural backgrounds and how these influence their relationship. Therapists should actively inquire about cultural values, family traditions, communication norms, and expectations related to marriage and conflict. This information should then be used to inform the application of Gottman method principles, adapting interventions to be culturally congruent. This involves a collaborative approach where the therapist and couple work together to understand how cultural factors interact with their relationship dynamics, rather than imposing a one-size-fits-all model. Question 13. Stakeholder feedback indicates that some clients express a strong desire for specific Gottman method interventions, such as the art of active listening exercises, early in therapy, even before a comprehensive assessment of their relationship dynamics has been completed. As a certified Gottman therapist, how should you approach this situation to ensure adherence to the Gottman method's principles and ethical practice? Option A. Immediately implement the requested art of active listening exercises as the client has explicitly asked for them, to demonstrate responsiveness to their needs. Option B. Politely decline the client's request for specific exercises, stating that the Gottman method only allows for interventions after a full diagnostic evaluation is complete. Option C. Explain the importance of a thorough assessment phase within the Gottman method to understand the couple's unique relationship dynamics before introducing specific interventions, and collaboratively discuss how the requested intervention might fit into a broader, tailored treatment plan. Option D. Suggest that the client might benefit more from a different therapeutic modality that focuses on skill-building exercises from the outset, as the Gottman method is too assessment-heavy. The correct answer is C. Explain the importance of a thorough assessment phase within the Gottman method to understand the couple's unique relationship dynamics before introducing specific interventions, and collaboratively discuss how the requested intervention might fit into a broader, tailored treatment plan. Explanation. This scenario presents a professional challenge because it requires the certified Gottman therapist to navigate a situation where a client's expressed desire for a specific intervention may not align with the foundational principles of the Gottman method, particularly concerning the assessment of relationship dynamics. The therapist must balance client autonomy with the ethical obligation to provide evidence-based and appropriate therapeutic interventions. Careful judgment is required to avoid imposing a therapeutic agenda, while also ensuring the client receives the most effective support. The correct approach represents best professional practice because it prioritizes a thorough assessment phase, which is a cornerstone of the Gottman method. This assessment allows the therapist to understand the couple's relationship dynamics, identify core issues, and collaboratively develop a treatment plan. This aligns with ethical guidelines that mandate competent and evidence-based practice. By focusing on the sound relationship house and other Gottman assessment tools, the therapist ensures that interventions are tailored to the couple's specific needs and are grounded in research. This approach respects the client's experience while upholding professional standards for effective therapy. An incorrect approach that focuses solely on implementing the requested intervention without a comprehensive assessment would be professionally unacceptable. This would represent a failure to adhere to the Gottman method's established protocols and could lead to ineffective or even detrimental therapeutic outcomes. Ethically, it could be seen as practicing outside the scope of competent care if the therapist lacks sufficient understanding of the couple's underlying issues. Another incorrect approach, such as dismissing the client's request outright without exploration, could alienate the client and damage the therapeutic alliance, potentially violating principles of client-centered care and respect. Professionals should employ a decision-making framework that begins with active listening and empathy to understand the client's request and underlying motivations. This is followed by a systematic assessment phase, utilizing appropriate Gottman method tools to gather comprehensive data about the relationship. Based on this assessment, the therapist then collaboratively discusses findings and potential treatment pathways with the couple, ensuring transparency and shared decision-making. This iterative process of assessment, collaboration, and intervention planning is crucial for ethical and effective practice. Question 14. Regulatory review indicates that a couple presents with significant conflict stemming from perceived neglect and differing expectations regarding emotional support. The husband feels his efforts are unappreciated, while the wife feels unheard and unsupported in her daily stressors. They frequently engage in cycles of withdrawal and escalating arguments. As a certified Gottman therapist, which of the following approaches would be most aligned with the Gottman method's framework for addressing such relational distress? Option A. Focus on uncovering the wife's childhood experiences of neglect and the husband's early experiences of feeling unappreciated, exploring how these past traumas may be unconsciously influencing their current relationship dynamics. Option B. Prioritize validating the wife's feelings of being unheard and unsupported, as her experience of daily stressors appears to be the primary driver of the couple's current conflict. Option C. Facilitate a discussion where each partner identifies specific instances of unmet needs and explores the underlying emotions and physiological responses associated with those instances, then collaboratively brainstorms small, actionable steps to meet those needs in future interactions. Option D. Guide the couple in identifying who is primarily responsible for the current state of their relationship, encouraging them to express their grievances and assign blame to facilitate a cathartic release of pent-up emotions. The correct answer is C. Facilitate a discussion where each partner identifies specific instances of unmet needs and explores the underlying emotions and physiological responses associated with those instances, then collaboratively brainstorm small, actionable steps to meet those needs in future interactions. Explanation. Scenario analysis. This scenario presents a common challenge in couples therapy where differing individual needs and past experiences can create significant relational distress. The therapist must navigate the delicate balance of validating each partner's perspective while also guiding them towards a shared understanding and constructive resolution. The challenge lies in avoiding triangulation, maintaining neutrality, and ensuring that interventions are grounded in evidence-based practice, specifically the Gottman method, which emphasizes observable behaviors and interaction patterns. The therapist's judgment is crucial in determining the most effective intervention to address the core issues without exacerbating conflict or alienating either partner. Correct approach analysis. The correct approach, focusing on identifying and modifying negative interaction patterns such as criticism and defensiveness, directly aligns with the core principles of the Gottman method. This method, as outlined in the Gottman Institute's training and ethical guidelines for certified Gottman therapists, prioritizes observable communication dynamics. By facilitating a discussion about specific instances of conflict and helping the couple to understand the underlying emotions and needs driving their reactions, the therapist empowers them to develop healthier ways of interacting. This approach is ethically sound as it is client-centered, evidence-based, and aims to improve the couple's relationship functioning. It respects the autonomy of both partners by providing tools for self-management and improved communication. Incorrect approach is analysis, an approach that solely focuses on uncovering deep-seated childhood traumas without linking them to current interaction patterns risks straying from the Gottman method's focus on present-day relationship dynamics. While past experiences are relevant, the Gottman method's strength lies in its ability to translate these into actionable strategies for improving current interactions. Ethically, this could be problematic if it leads to excessive dwelling on the past without tangible progress in the present relationship, potentially causing further distress or a sense of hopelessness. An approach that prioritizes one partner's narrative and feelings over the others, even with good intentions, can lead to perceived bias and further entrenchment of conflict. This violates the ethical principle of impartiality and can undermine the therapeutic alliance with the disfavored partner. The Gottman method emphasizes equal validation of both partners' experiences within the context of their interaction, an approach that focuses on assigning blame for the relationship's problems, rather than understanding the systemic patterns of interaction, is counterproductive. This can escalate defensiveness and resentment, directly opposing the Gottman method's goal of fostering understanding and empathy. Ethically, blame-oriented therapy can be damaging and is not aligned with therapeutic best practices for couples work. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the couple's interaction patterns, utilizing Gottman-specific assessment tools if applicable. The therapist should then identify the core issues that are contributing to their distress, always maintaining neutrality and ensuring both partners feel heard and validated. Interventions should be chosen based on their evidence-based efficacy within the Gottman method, with a clear rationale for how they will address the identified problems. Ongoing assessment of the couple's progress and adjustment of the treatment plan as needed are crucial. Ethical considerations, including confidentiality, informed consent, and the avoidance of harm, must guide every step of the therapeutic process. Question 15. Process analysis reveals a couple's therapy session where partner A expresses significant emotional pain and a strong desire for partner B to change their behavior, while partner B remains largely silent, appearing withdrawn and disengaged. The therapist observes this dynamic. Which of the following therapeutic responses best aligns with the principles of fostering empathy and understanding within the Gottman method framework? Option A. Suggests that the couple take a break from therapy to reflect individually, as the current session is unproductive due to partner B's withdrawal. Option B. Directly address partner B's silence, stating that their lack of participation is hindering the therapeutic process and demanding they express their thoughts and feelings immediately. Option C. Focus exclusively on partner A's narrative, exploring their pain in detail and formulating specific behavioral change requests for partner B based on this exploration. Option D. Validate partner A's feelings and experiences, acknowledging the difficulty of their situation, and then gently invite partner B to share their perspective on what they are hearing and feeling, framing it as an effort to understand partner A better. The correct answer is D. Validate partner A's feelings and experiences, acknowledging the difficulty of their situation, and then gently invite partner B to share their perspective on what they are hearing and feeling, framing it as an effort to understand partner A better. Explanation. Scenario analysis. This scenario presents a common challenge in couples therapy where one partner expresses significant distress and a desire for change, while the other partner appears withdrawn and resistant. The therapist must navigate the delicate balance of validating the distressed partner's experience without alienating the withdrawn partner, and simultaneously foster an environment where both partners feel heard and understood. The core challenge lies in facilitating empathy between partners when one is actively shutting down, which can easily lead to a therapeutic impasse or exacerbate existing relational dynamics. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the Gottman method's core principle of building empathy and understanding within the couple. By actively validating the distressed partner's feelings and experiences, the therapist creates a safe space for them to express their pain. Simultaneously, the therapist gently invites the withdrawn partner to share their perspective, framing it as an attempt to understand their partner's feelings better. This approach aligns with ethical guidelines that mandate therapists to foster a collaborative and respectful therapeutic environment, ensuring both partners' voices are acknowledged. It directly addresses the goal of increasing empathy by modeling it and encouraging its development between the partners, which is fundamental to Gottman method interventions aimed at improving relationship satisfaction and conflict resolution. Incorrect approaches analysis. One incorrect approach might involve solely focusing on the distressed partner's narrative, inadvertently reinforcing the withdrawn partner's sense of being unheard or blamed. This could violate ethical principles of impartiality and fairness in couples therapy, potentially leading to an escalation of conflict or the withdrawal partner disengaging further. It fails to uphold the Gottman principle of addressing both partners' experiences equally. Another incorrect approach could be to directly confront the withdrawn partner with accusatory language, demanding they open up or participate. This is ethically problematic as it can be perceived as judgmental and coercive, damaging the therapeutic alliance and potentially triggering defensiveness. It directly contradicts the Gottman method's emphasis on creating safety and understanding, and can be seen as a failure to adhere to professional standards of non-judgmental therapeutic engagement. A third incorrect approach might be to prematurely introduce problem-solving techniques without first establishing a foundation of empathy and understanding. This bypasses the crucial step of helping partners connect with each other's emotional experiences, which is a prerequisite for effective conflict resolution in the Gottman method. Ethically, this could be seen as a failure to provide competent therapy by not following established, evidence-based protocols, potentially leading to ineffective treatment and client dissatisfaction. Professional reasoning. Professionals should employ a decision-making framework that begins with assessing the current relational dynamics and the emotional states of each partner. This involves active listening, empathetic validation of expressed feelings, and a gentle, non-judgmental invitation for both partners to share their perspectives. The therapist should continuously monitor the therapeutic alliance, adjusting their approach to ensure both partners feel safe and respected. In situations involving withdrawal, the focus should be on creating an environment where the withdrawn partner feels safe enough to begin sharing, rather than demanding immediate disclosure. This iterative process of assessment, validation, and gentle invitation, guided by the principles of the Gottman method, ensures ethical and effective therapeutic practice. Question 16. System analysis indicates that a new client who has previously had negative experiences with therapy expresses significant skepticism about the effectiveness of couples counseling and specifically questions the value of the Gottman method, stating, "I've tried therapy before, and it just made things worse. I don't see how talking about feelings is going to fix our problems. How should a certified Gottman therapist prioritize their initial actions to establish a therapeutic alliance? Option A. Gently challenge the client's skepticism by highlighting the flaws in their previous therapeutic experiences and presenting the Gottman method as a superior alternative that guarantees positive outcomes. Option B. Immediately begin explaining the theoretical underpinnings of the Gottman method and its research-based efficacy, assuring the client that this time will be different and that their skepticism is unfounded. Option C. Acknowledge the client's past negative experiences with empathy, validate their feelings of skepticism, and express a commitment to building a collaborative and trusting relationship by explaining how the Gottman method focuses on practical skills and observable behaviors, adapting the approach to their specific concerns. Option D. Agree with the client's assessment that therapy can be ineffective and suggest that perhaps couples counseling is not the right approach for them at this time, offering to explore individual coping strategies instead. The correct answer is C. Acknowledge the client's past negative experiences with empathy, validate their feelings of skepticism, and express a commitment to building a collaborative and trusting relationship by explaining how the Gottman method focuses on practical skills and observable behaviors, adapting the approach to their specific concerns. Explanation. Scenario analysis. This scenario presents a common challenge in establishing a therapeutic alliance. A client's initial resistance and skepticism, coupled with a history of negative therapeutic experiences. The therapist must navigate this delicate situation to build trust and rapport without invalidating the client's feelings or prematurely pushing for deeper engagement. The risk lies in either alienating the client further through an overly directive or dismissive approach, or conversely, appearing disengaged and unhelpful by not actively seeking to understand and address the client's concerns. Correct approach analysis. The correct approach demonstrates an understanding of the Gottman method's emphasis on building a strong foundation of friendship and trust within the therapeutic relationship. By actively listening, validating the client's past negative experiences, and expressing a commitment to a different approach, the therapist is prioritizing the establishment of a secure and trusting alliance. This aligns with ethical guidelines that mandate client-centered care and the creation of a safe therapeutic space. Specifically, it reflects the Gottman principle of turning towards bids for connection, even when those bids are expressed through skepticism. This approach fosters a sense of safety and encourages the client to gradually open up, which is crucial for effective therapy. Incorrect approaches analysis. One incorrect approach involves immediately launching into Gottman method exercises without adequately addressing the client's stated reservations. This fails to acknowledge the client's emotional state and past experiences, potentially reinforcing their belief that therapists are not listening or understanding. This can be seen as a failure to establish a foundational alliance, which is a prerequisite for the effective application of any therapeutic modality. Ethically, it disregards the client's autonomy and their right to feel heard and understood before engaging in therapeutic interventions. Another incorrect approach is to become defensive or overly eager to prove the efficacy of the Gottman method. This can create an adversarial dynamic, shifting the focus from the client's needs to the therapist's need to be right. It undermines the collaborative nature of therapy and can damage the nascent alliance. From an ethical standpoint, this approach prioritizes the therapist's agenda over the client's well-being and can be perceived as manipulative or dismissive of the client's concerns. A third incorrect approach is to simply agree with the client's skepticism without offering a clear path forward or demonstrating a willingness to adapt. While validation is important, a passive stance can lead to a lack of direction and a sense that the therapist is not equipped to help. This can result in the client disengaging from therapy, feeling that their time and emotional investment are not being utilized effectively. Ethically, this can be viewed as a failure to provide competent and effective therapeutic services. Professional reasoning. When faced with a client expressing skepticism and past negative experiences, a therapist should first prioritize active listening and empathetic validation. The therapist should acknowledge the client's feelings and experiences without judgment. Following this, the therapist should clearly articulate their commitment to building a collaborative and trusting relationship, explaining how their approach differs and how they intend to address the client's concerns. This involves transparency about the therapeutic process and a willingness to adapt the pace and focus based on the client's comfort level. The goal is to create a safe space where the client feels empowered to explore their relationship issues. Question 17. Implementation of strategies to build shared meaning and purpose within a couple's relationship, as guided by the Gottman method, requires a therapist to actively facilitate the exploration and co-creation of a shared life. Which of the following approaches best exemplifies this principle from a stakeholder perspective, considering the couple as the primary stakeholders in their relational future? Option A. Guiding the couple to identify and articulate their individual dreams, values, and life goals, and then facilitating a dialogue to discover commonalities and build a shared vision for their future together. Option B. Prioritizing the development of individual career and personal goals for each partner, with the expectation that their separate successes will automatically create a cohesive shared life. Option C. Focusing primarily on resolving immediate conflicts and disagreements, assuming that a reduction in conflict will naturally lead to a stronger sense of shared purpose. Option D. Encouraging the couple to adopt a set of universally recognized values and life goals that the therapist believes are essential for a successful long-term relationship. The correct answer is A. Guiding the couple to identify and articulate their individual dreams, values, and life goals, and then facilitating a dialogue to discover commonalities and build a shared vision for their future together. Explanation. This scenario presents a professional challenge because building shared meaning and purpose in a relationship requires navigating individual histories, values, and future aspirations. It demands sensitivity to potential conflicts arising from differing perspectives and the ability to foster a collaborative environment where both partners feel heard and valued. The Gottman method emphasizes that shared meaning is not about agreement on every detail, but about creating a sense of shared life, rituals, and goals that bind the couple together. The correct approach represents best professional practice because it directly aligns with the core principles of the Gottman method for building shared meaning. It involves actively exploring the couple's individual dreams, values, and life goals, and then facilitating a dialogue to identify common ground and create a shared vision for their future. This process honors each partner's unique contributions and fosters a sense of partnership, which is crucial for long-term relationship satisfaction and resilience. This approach is ethically sound as it prioritizes client autonomy and well-being by empowering them to co-create their shared future. An incorrect approach that focuses solely on resolving immediate conflicts without addressing the underlying foundation of shared meaning would be professionally deficient. This fails to address the root cause of potential disconnection and may lead to recurring issues. Ethically, it could be seen as providing superficial treatment that does not equip the couple with the tools for sustained relational health. Another incorrect approach that imposes the therapist's own vision of a meaningful life onto the couple is a significant ethical failure. This violates the principle of client-centered practice and can lead to resentment and a breakdown of trust. It also disregards the unique cultural, spiritual, and personal values that define a couple's shared meaning. A third incorrect approach that prioritizes individual goal setting over shared purpose neglects the fundamental Gottman principle that shared meaning is a joint endeavor. While individual growth is important, a lack of shared purpose can leave a couple feeling like they are living parallel lives rather than a unified one, undermining the very essence of partnership. This approach fails to build the relational glue that sustains a long-term commitment. The professional decision-making process for similar situations should involve a thorough assessment of the couple's current relational dynamics, their individual aspirations, and their existing shared experiences. The therapist must then employ Gottman-informed interventions that facilitate open communication, mutual understanding, and collaborative vision building. This requires a commitment to a client-led process, where the therapist acts as a guide and facilitator, rather than an arbiter or director of the couple's shared life. Question 18. Stakeholder feedback indicates that a certified Gottman therapist is working with a couple from a collectivist cultural background, where direct confrontation is highly discouraged and saving face is paramount. The couple presents with communication breakdowns related to household responsibilities and financial planning. The therapist is considering how to adapt Gottman method interventions, such as the house of intimacy or conflict resolution techniques. Which of the following approaches best balances cultural sensitivity with the core principles of the Gottman method? Option A. The therapist decides to bypass specific Gottman conflict resolution techniques altogether, believing that direct intervention in conflict is culturally inappropriate for this couple, and focuses solely on general relationship support, without addressing the specific communication patterns that are causing distress. Option B. The therapist proceeds with the standard Gottman method interventions as outlined in the training, assuming that the underlying principles of healthy relationships are universally applicable and that the couple will adapt to the therapeutic framework. Option C. The therapist actively inquires about the couple's cultural values and beliefs regarding family roles, communication, and conflict. They then collaboratively explore how to adapt the core concepts of the Gottman method, such as the soften startup and finding the 5 love languages, to align with the couple's cultural norms and preferred communication styles, potentially using indirect communication strategies or focusing on shared community values. Option D. The therapist explains the Gottman method's conflict resolution principles in detail, emphasizing the importance of direct and open expression of feelings, and encourages the couple to adopt these Western communication norms to improve their relationship. The correct answer is C. The therapist actively inquires about the couple's cultural values and beliefs regarding family roles, communication, and conflict. They then collaboratively explore how to adapt the core concepts of the Gottman method, such as the soften startup and finding the 5 love languages, to align with the couple's cultural norms and preferred communication styles, potentially using indirect communication strategies or focusing on shared community values. Explanation. This scenario presents a professional challenge because it requires a certified Gottman therapist to navigate the complexities of cultural differences while adhering to the core principles of the Gottman method. The challenge lies in adapting therapeutic interventions without diluting their effectiveness or inadvertently imposing Western cultural norms onto clients from diverse backgrounds. Careful judgment is required to ensure cultural sensitivity, client autonomy, and therapeutic efficacy. The correct approach represents best professional practice because it prioritizes a deep understanding of the couple's cultural framework and its influence on their relationship dynamics. This involves actively seeking to learn from the clients, integrating their cultural values and communication styles into the therapeutic process, and tailoring interventions to be culturally congruent. This aligns with ethical guidelines that emphasize cultural competence and the importance of providing services that are responsive to the diverse needs of clients. It respects the client's lived experience and avoids a one-size-fits-all approach, which is fundamental to effective and ethical therapy. An incorrect approach that relies solely on direct translation of Gottman exercises without cultural adaptation fails to acknowledge the nuances of cultural communication and relational expectations. This can lead to misunderstandings, client resistance, and a breakdown in the therapeutic alliance. It represents an ethical failure to provide culturally competent care, potentially causing harm by imposing a framework that is not resonant or even comprehensible within the client's cultural context. Another incorrect approach that dismisses cultural influences as irrelevant to core relationship dynamics ignores the profound impact culture has on interpersonal interactions, communication patterns, and conflict resolution. This is an ethical failure to recognize and address a significant factor influencing the couple's relationship, leading to an incomplete and potentially ineffective therapeutic intervention. Professionals should employ a decision-making framework that begins with self-awareness of their own cultural biases. This is followed by a commitment to ongoing cultural humility and a willingness to learn from clients about their cultural perspectives. When adapting interventions, the process should be collaborative, involving the clients in identifying how specific Gottman concepts can be meaningfully integrated into their lives, respecting their cultural norms and values. This iterative process of assessment, adaptation, and feedback ensures that the therapy remains relevant, respectful, and effective. Question 19. The risk matrix shows a high probability of relationship damage due to escalating conflict during a session. The couple is intensely arguing, with each partner feeling misunderstood and unheard. Which of the following therapist interventions is most likely to de-escalate the situation and facilitate constructive communication, adhering to the principles of the Gottman method and ethical therapeutic practice? Option A. Allow the argument to continue, believing that the couple needs to express their frustrations fully before any progress can be made. Option B. Immediately offer practical solutions to the problem they are arguing about, suggesting compromises to end the disagreement quickly. Option C. Express concern about the intensity of their emotions and suggest they take a break from therapy if they cannot control their reactions. Option D. Validate each partner's feelings by reflecting their emotional experience. Then gently guide the conversation towards identifying the underlying needs and the shared goal of resolving the issue. The correct answer is D. Validate each partner's feelings by reflecting their emotional experience. Then gently guide the conversation towards identifying the underlying needs and the shared goal of resolving the issue. Explanation. Scenario analysis. This scenario presents a common challenge in couples therapy where escalating conflict can quickly derail therapeutic progress and create an unsafe environment for the couple. The therapist must navigate the intense emotions and communication breakdown to guide the couple towards de-escalation without taking sides or imposing solutions. The risk of further damaging the relationship or causing emotional distress to the clients is significant, necessitating a skilled and ethically grounded approach. Correct approach analysis. The correct approach, focusing on validating each partner's feelings and then gently redirecting the conversation to the underlying needs and the shared goal of resolving the conflict, aligns with the Gottman method's emphasis on emotional attunement and constructive communication. Validating feelings acknowledges the emotional reality for each person, which is crucial for de-escalation. Redirecting to underlying needs and shared goals shifts the focus from blame to problem solving, fostering collaboration. This approach is ethically sound as it prioritizes client well-being, maintains neutrality, and empowers the couple to develop their own conflict resolution skills, consistent with professional ethical guidelines for therapists that emphasize client autonomy and non-maleficence. Incorrect approaches analysis. One incorrect approach might involve immediately offering solutions or advice. This is ethically problematic because it bypasses the crucial step of emotional validation, potentially making one or both partners feel unheard and invalidated. It can also be perceived as taking sides, undermining the therapist's neutrality and the trust essential for therapeutic progress. This approach fails to address the emotional intensity that fuels the conflict. Another incorrect approach could be to allow the argument to continue unchecked, hoping it will naturally resolve. This is a failure of professional responsibility and potentially harmful. It risks further entrenching negative communication patterns, increasing the couple's distress, and could be seen as a dereliction of duty to actively facilitate a therapeutic process. Ethically, therapists have a responsibility to intervene when client safety or therapeutic progress is compromised. A third incorrect approach might involve expressing frustration or judgment towards one or both partners. This is a severe ethical breach. It violates the core principles of empathy, unconditional positive regard, and professional neutrality. Such behavior can cause significant harm to the clients, damage the therapeutic alliance, and is a direct contravention of ethical codes that mandate professional conduct and client welfare. Professional reasoning. Professionals should employ a decision-making process that begins with assessing the emotional temperature of the session. When conflict escalates, the priority is to create safety and reduce emotional intensity. This involves active listening, empathetic attunement, and the use of de-escalation techniques that validate feelings without necessarily agreeing with the content of the statements. The therapist then guides the couple towards identifying the core issues and their underlying needs, fostering a collaborative problem-solving approach. This process is guided by ethical principles of beneficence, non-maleficence, justice, and respect for client autonomy, ensuring that interventions are in the best interest of the couple and the therapeutic process. Question 20. The control framework reveals that a couple, married for 15 years, presents with significant distress. The husband expresses feeling constantly misunderstood and invalidated by his wife, leading to his withdrawal and increased anxiety. The wife reports feeling overwhelmed by her husband's emotional needs and expresses a desire for more personal space, which she feels is not respected. Considering the sound relationship house theory, which of the following therapeutic approaches would best address their core relational challenges? Option A. Suggest a temporary separation to allow each partner to gain perspective and reduce immediate relational pressure. Option B. Recommend individual therapy for the husband to address his anxiety and feelings of being misunderstood, while the wife pursues her need for personal space. Option C. Focus on strengthening the love maps by exploring each partner's inner world, understanding their individual hopes, fears, and dreams, and facilitating empathetic communication about these experiences. Option D. Immediately implement advanced conflict resolution strategies to manage their frequent arguments and disagreements. The correct answer is C. Focus on strengthening the love maps by exploring each partner's inner world, understanding their individual hopes, fears, and dreams, and facilitating empathetic communication about these experiences. Explanation. Scenario analysis. This scenario presents a common challenge in couples therapy where one partner's distress significantly impacts the relationship's stability, potentially overshadowing the other's needs. The therapist must navigate the delicate balance of addressing individual suffering while upholding the core principles of the Sound Relationship House, SRH theory, which emphasizes the interconnectedness of the couple's dynamic. The challenge lies in ensuring that interventions are not solely focused on alleviating one partner's symptoms, but contribute to building a stronger, more resilient relationship foundation for both. Correct approach analysis. The correct approach focuses on identifying and strengthening the love maps component of the Sound Relationship House. This aligns with Gottman method principles by emphasizing the importance of deep knowledge of each other's inner worlds, including hopes, fears, and dreams. By exploring the husband's feelings of being misunderstood and the wife's feelings of being overwhelmed, the therapist is directly addressing the foundational elements of connection and understanding. This approach fosters empathy, validates both partners' experiences, and lays the groundwork for building trust and intimacy, which are crucial for addressing other SRH components like fondness and admiration, turning toward each other, and positive perspective. This is best professional practice as it directly applies the SRH theory to the couples presenting issues, promoting a holistic and systemic approach to relationship repair. Correct approach is analysis, an approach that solely focuses on the husband's anxiety and suggests individual therapy without integrating it into the couple's dynamic fails to address the relational context. This is a regulatory and ethical failure because it neglects the core tenet of couples therapy, which is to work with the dyad. It risks pathologizing one partner and overlooks how the relationship dynamics might be contributing to or exacerbating his anxiety. An approach that prioritizes the wife's need for space and suggests temporary separation without first exploring the underlying relational issues and attempting to build stronger connection within the SRH framework is also problematic. This could be seen as an ethical failure to adequately assess and intervene in the relationship's core issues. While space can sometimes be a tool, it should be a considered strategy within a therapeutic plan, not an immediate solution that bypasses the opportunity to strengthen the relationship's foundation. An approach that focuses exclusively on conflict resolution techniques without first establishing a strong foundation of friendship and emotional connection, love maps, fondness, and admiration, is premature. This represents a failure to adhere to the sequential and foundational nature of the SRH theory. Without understanding each other's inner worlds and appreciating each other, conflict resolution can become superficial or even damaging, as underlying resentments may not be addressed. Professional reasoning. Professionals should utilize a decision-making process that begins with a thorough assessment of the couple's relationship through the lens of the Sound Relationship House. This involves understanding how each component of the SRH is functioning or malfunctioning. The therapist should then prioritize interventions that address the most foundational elements that are currently weak, as these often underpin other difficulties. The goal is to build a strong, interconnected system where both partners feel understood, valued, and connected, enabling them to navigate challenges more effectively. This systematic, theory-driven approach ensures that interventions are relevant, effective, and ethically sound within the scope of couples therapy.